I'm a registered x-ray tech, so I perform multiple x-rays during the day for the doctor I work for, and I'm doing between 20 and I'd say 35 x-rays. I do a lot of joints. I don't do a lot of necks or, fingers. I do the main hip, knee, shoulder, sometimes a foot. And so then if we were looking at the knee, I would, the x-ray machine's that on, so I can't show the light. There's actually a light. When I push this button, a light will illuminate. And then there's these buttons here that I can change to adjust to his knee size or his leg size. And then I would there's a red laser line that will come down, and that I use for my center point. And so I would put that, if his kneecap was hurting or his patella, I would put it, right dead center on that. And I would go ahead and get him set up. He would be shielded. We have lead shielding for the patients. There's an apron. There's 2 full body ones that cover from about knee to up here with a little loop neck. And then there's a thyroid shield that they can just put around their neck that protects this area. And as for me, I use a x-ray badge. It's a dosimeter that'll see how much radiation I get every month. We always ask for female patients if there's a possibility they could be pregnant. Just a standard here. And then if he wanted a thyroid shield, I would definitely give it to him. So then I would just kind of lay that across his neck. And then I would have him hold really still, and I would come around here. And I would be behind this wall. But as long as you can make them feel comfortable and explain what you're doing. There's certain laws that go along with it, so you got to be careful when you touch or move a patient. Make sure you're not, touching or moving them somewhere you shouldn't be. So you just got to explain what you're doing, make sure they're okay with it. I really just like talking to my patients and learning about them and why they're here. I just like to get to know them on a different level other than them just being a patient. Well, this is the computer we use to get our patient load put on here. So, they'll order an x-ray for a certain patient, and then this is where the list of the appointments and the patients are, and I have to select the patient, and then I grab one of these cassettes here. So grab this one, and then I'll put it in here, and then there's a button that says ID, which means it's going to ID the cassette to that patient's name, date of birth. It'll get it to them on their other system. And then I will take the x-ray, and to take the x-ray, I come over here, I select the body part I want to do. We have a skeleton man that we just select. So if I want to do a shoulder, I'll select shoulder. We do 3 different views here. The hospitals are different, just depends on the doctor. And then this is for the tube. This would be turned on already, and the tube is just out there. And then this is what you take or what you push to make an exposure. But you just have to hold it down for 2 to 3 seconds. And then I would go ahead and get the cassette and bring it back over here to this machine. And you put it in, and it'll kind of take it around through this whole machine. It opens it up, pulls the film out, develops it. It comes up on this screen once it's developed. That whole process for it to develop is about 45 seconds to a minute. So in the meantime, I'm doing other x-rays just to be efficient here. And then I just wait for the cassette or the picture to come up, make sure I have everything I need and everything I want. Classes I would recommend for students would be get as much of the college credits that are offered. Actually, all of them help you in some way. I would definitely say if you could take anatomy and physiology in high school, it really helps you. You don't get a credit for it towards college, but then when you take the college one where you get the credit, it helps you immensely. The steps I took to get into college included taking as many college classes I could in high school. I did 2 years of prereqs, which were Common Core classes that the radiology program required, which some of them included physics, A&P, some chemistry. I think it's one of the best fields in the medical profession, not just because I do it, but I think it really helps with diagnosing. It's a huge diagnostic tool when it comes to clinics, hospitals, because there's so many outlets of radiography. There's MRI, there's CT, there's ultrasound, and there's just a bunch of stuff that can help diagnose different diseases, cancers. Some of the other things we use here in x-ray or in the x-ray field is math. You determine the amount of radiation the patient gets. Science would be a part of it too, because you got to know how the body functions or get the gist of it. So I'd say biology would be a good part of it.